Good afternoon. Today is Tuesday, May 18th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today are Teresa Woolson, volunteer member of the Oswego County Suicide Prevention Coalition, and Diane Oldenburg, Senior Public Health Educator for the County Health Department. Last week's meeting of the County Legislature included a number of speakers during the public comment period who shared their opinions about the use of vaccines and personal protective equipment, such as masks, in the fight against the coronavirus. Coincidentally, the CDC also provided new guidance on the issue of face coverings for those that are fully vaccinated last week, and we have moved to respond to their suggestions. Tomorrow marks the day we've all been looking forward to. Governor Cuomo announced that, effective tomorrow, the state will adopt the CDC's guidance on eliminating the face mask requirement for fully vaccinated people in most situations. For the most part, the new guidance allows those who are fully vaccinated to resume their normal pre-pandemic activities. They can participate in indoor and outdoor activities without wearing a mask or social distancing. Earlier today, Jen Chang Wang, our Public Health Director, and I modified our position to also adopt the CDC's new guidance on face masking and social distancing as it relates to county facilities and property. All fully vaccinated employees and members of the public who are at least 2 weeks past the date of receiving their second dose of either the Pfizer or Moderna vaccines, or 2 weeks past the date of receiving their Johnson & Johnson vaccine, will no longer be required to wear a face covering or maintain social distancing while at work or in county facilities, either indoors or outdoors, unless a face covering is otherwise required by state or federal law, regulation, or order. Employees who are not fully vaccinated are still required to wear a mask when not seated at their desk. Unvaccinated people and those who are immunocompromised, even if they are vaccinated, should continue to wear face masks and social distance. There are some exceptions, of course. Per the guidance, face masks will still be required for everyone on public transportation, in healthcare settings, schools, homeless shelters, nursing homes, and correctional facilities. This includes the county jail and the county health department and its clinics. The new guidance also allows individuals and private businesses to make their own choice of masking. Just as many people who were not comfortable adopting the mask protocol last year, many may not feel comfortable without them just yet. Please be respectful of individuals who may still feel safest wearing their mask in public, and of business owners who may still ask patrons to wear their mask. Also, effective tomorrow, New York State will lift many of its curfew and capacity restrictions on businesses across the state. The curfew for outdoor food and beverage service was lifted yesterday, and the curfew for indoor service expires at midnight on Monday, May 31st. Capacity restrictions based on a percentage of the facility's maximum capacity will be dropped. Instead, businesses will only be limited by the space available to maintain the social distancing requirement of 6 feet. Businesses may eliminate the 6 feet of social distancing to increase capacity, but only if all patrons and employees within the establishment or a separate part of an establishment present proof of full vaccination status. We've worked together as a community to make this progress, and we need to continue working together to get everyone vaccinated and further reduce the number of positive COVID-19 cases. Vaccination is the key. As of today, 44.9%, or 52,900 Oswego County residents have received at least one dose of the vaccines. 46,270 residents have completed the vaccine series. If you haven't been vaccinated, now is the time to act. Now that we are moving forward with the reopening and restrictions are being lifted for those who are vaccinated, make your appointment and get your vaccination. Many places are offering the vaccine now. Call the county's COVID-19 hotline at 315-349-3330 for more information. We continue to mark May as National Mental Health Awareness Month with timely information to help people cope, practice self-care, and reduce the stigma of mental health that too often prevents people from asking for help. And today, Teresa is here to give us more information about mental health care.
Thank you, Chairman Weatherup. May is National Mental Health Awareness Month, and the Oswego County Suicide Prevention Coalition strives to bring an end to the stigma of mental health and to help build a community where people are free to talk comfortably about their struggles without fear of judgment, ridicule, or backlash. According to the National Institute of Mental Health, nearly 1 in 5 U.S. adults live with a mental illness. In 2019, there were an estimated 51.5 million adults age 18 or older with a diagnosed mental illness in the United States. Among the biggest reasons so few are seeking out treatment is the fear and shame caused by stigma. The Oswego County Suicide Prevention Coalition's mission is to collaborate with local community members to promote suicide prevention resources, raise awareness, provide support, and lower suicide rates in Oswego County. Having a platform to educate our community on mental health struggles in connection with higher suicide rates allows us as a coalition to disavow the stigma, supply resources, and give community members confidence and trust in voicing when they are struggling with mental illness. We all have mental health and should be working to keep it positive and strong, just as you would maintain good physical health. This and every month, join the Oswego County Suicide Prevention Coalition in working on normalizing conversations about our mental health, removing stigmas, and educating the community on suicide prevention. Try getting out for a walk, volunteering with animals, going for a bike ride, or meeting up with friends and family. Remember, you are not alone. Your community is here to help you. If you or someone you love is struggling with mental health or has thoughts of suicide, please call the Suicide Prevention Lifeline at 1-800-273-TALK 8255 or text HOME to 741-741 or contact Liberty Resources 24/7 Mobile Crisis Team for Oswego County at 315-251-0800. Let's help make our community stronger and stand together. And now I'll turn to Diane for the latest COVID-19 report. Thank you.
Thank you, Teresa. As of this afternoon, we have a total active positive case rate of 122. Total tests that have been returned are 215,278. Total cumulative positive cases have been 7,968. Total negative test results received 204,517. Total patients released from isolation 7,757. And we have 90 deaths reported due to COVID-19 as reported by the New York State Department of Health. Currently, we have 424 residents on mandatory quarantine or isolation. Our 7-day positivity rate has gone down again from 2% last week to 1.7% this week. Our community transmission rate has also been lowered to substantial according to the CDC. This is good news and we must keep the momentum going. The health department is hosting another mini clinic. It is scheduled for Monday, May 24th at 5 o'clock at SUNY Oswego at Laker Hall, 30 Barnes Drive in Oswego. The Johnson & Johnson vaccine, which only requires 1 dose, will be administered. For more information about COVID vaccines, go to covid19.health.ny.gov and click on the fact sheet for each one. Registration links for vaccination clinics are posted on the health department's COVID-19 vaccine page. Check the site frequently as appointments often open up at short notice when others reschedule their appointments or more vaccine becomes available. You can also call the Oswego County COVID-19 hotline from 8:30 a.m. to 4 p.m. weekdays for help in making an appointment. dial 315-349-3330. If you are eligible to receive the vaccine, please make an appointment today and get vaccinated. The COVID-19 vaccine will protect you and your family from the virus. It prevents serious illness, hospitalizations, and death. The vaccine is safe, effective, and free. Whether you have health insurance or not, you can get your vaccination at no cost. If you have questions or concerns about the vaccines, call your doctor or the county's COVID-19 hotline. We're all available to help you. Thanks.
Thank you, Diane. With New York State lifting most of its restrictions tomorrow, you can check the state's website for additional information about guidance or updates. On the county government level, we will now scale back these information videos. Going forward, they will be recorded and posted every other Tuesday instead of every week. Our next video will air on Tuesday, June 1st, with the latest county business and COVID-19 information. In other county news, the broadband internet study is still open. Consumer-based community-wide data will be the key to acquiring the funds we need to close the broadband gaps that exist in our county. Please take 5 minutes to help us gather this information. Go to cnyinternet.com for more information and to answer the survey. If you don't have access to the internet, call 315-412-5966 to request a survey. The Health Department's Environmental Division is holding an appointment-only rabies clinic from 6 to 8 p.m. tomorrow at the County Highway Garage in Parrish. The Office for the Aging is offering a virtual Medicare 101 session at 10 a.m. next Thursday, May 27th. The Veteran Service Agency is still accepting nominations for the 2021 Oswego County Veteran of the Year Award. Call 315-591-9100 for details. For more information about county government services and programs, go to oswegocounty.com. For the latest information on COVID-19, including vaccination clinics and testing, go to the Health Department's COVID-19 page. Although the pandemic is not over and more challenges may lie ahead, I want to thank you for your cooperation and support over the last year. Thank you for doing your part to keep our community safe and helping us recapture a sense of normalcy once again.